with Shakthi Health and Wellness Center. And today with Dr. Sudhir Rao, we are going to present an integrative approach to kind of an epidemic situation of joint pains, including knee, hip, and back. We have a series for regenerative solutions that involve multiple aspects of healing. So this is going to be the first part of a series, and we're going to today focus on the knee. So give me 1 second, make sure that there's a little bit of a glitch. Jake, can you make sure that Esrao has the slides?
Yeah, just to see what I'm presenting, or something for him to pull up on his end.
Something for him to pull up on his end.
Okay, give me 1 minute.
So while he's doing that, 2%. Sorry, just gotta take care of something. Okay, so while we're doing that, I just want to spend a minute talking about how severe knee pain can be in terms of, yes, we know that it is associated with bone on bone. We know that it can be associated with weight and getting to your ideal body mass index, as well as, visceral fat index, getting your body weight down to a place where your knee will benefit or weight bearing joints could benefit is really also a primary goal. But in order to do that, for lots of people, they can't be mobile when they have significant pain. Their knee pain keeps them from doing the things that they want to do with lifestyle. Lifestyle changes, which we'll talk about, help knee pain. And having knee pain, and impairs sleep, impairs movement, impairs the choices of food that we want to eat. So, it's a big deal in order to figure out, where to start. So we always talk about this treating pain as a kind of integrative approach, and I always focus at Shakthi on lifestyle. And so one of the things that we want to talk about, so there, let me know when you see when you get the slides up. I think he was having some technical issues there. Can you hear me, Sudhir? I don't know if he's also muted.
Yeah, give me 1 sec.
Okay. Anyway, so the issue is it's not just wear and tear. Part of the problem with knee pain is that it's a failure of repair. It also is an immune imbalance within the knee, and it involves regulation from the muscles and the nerves to speak to the brain that something's going on, that we need to repair it. And a lot of times when you have chronic issues, all the signaling mechanisms are not working properly. So yes, it might be bone on bone because you're an athlete or you've had a lot of years of heavy impact or you have high weight, but it's also an immune response, and it's also about blood flow and cleaning up debris within the knee space. And so that's where some of these regenerative therapies really make a difference. In the knee also, so there, when you're ready, you can talk about how it presents for you in terms of what parts of the knee you see impaired.
Yeah, I'm ready, Norm. So in general, can you hear me okay?
Yeah.
So when we talk about knee pain, we normally think of it as arthritis or osteoarthritis, which is really a degenerative and an inflammatory condition. What happens in the joint itself is you have inflammatory cytokines like TNF alpha and IL-1B causing difficulties in cell signaling, messing with the neuronal activity and impairing repair activity. So the joint itself gets more affected, the normal healing mechanisms are affected, and you're having what we call arthritis, which is really bone on bone pain or inflammation in the bone itself. This affects the cartilage, the synovium, the bone, and the neuromuscular signaling. If the normal conventional systems of treatment would be physical therapy, ice, anti-inflammatory medications, things to try to decrease the inflammation or really modify or manage your symptoms. Whereas in functional medicine, we're looking at what's the root cause of what's actually causing these symptoms, and then how do we regenerate?
Yeah. So again, it's not just wear and tear, it's really repair. Okay, next slide, Jake.
So we're looking at regenerative medicine and healing from within. And like I said earlier, unlike traditional or conventional treatments that suppress symptoms, regenerative medicine stimulates the body's own repair mechanisms to restore damaged tissue at a cellular level. It looks at root cause, trying to use minimal intervention, needle-based outpatient procedures with a quick recovery. And we're looking for lasting results that can provide long-term tissue repair rather than just temporary suppression of inflammation that returns.
So when we think about inflammation, one of the most powerful interventions we have is what food choices we make. And inflammatory food, not looking at food as just protein, carbs, and fats, but looking at inflammation potential of food is really, really important. There is an anti-inflammatory food list, elimination diet, it's also called. We'll attach that to this webinar, but it is one of the most powerful things you can do. Things like sugar for some people is very inflammatory. Actually, sugar for most of us is inflammatory, but nightshade vegetables, eggplant, peppers, tomatoes, these are in some people. I don't like to limit plant-based foods in anyone, but even some people have a arthritic component to it, they can have inflammation and pain from eating some of these nightshade vegetables. So it's sometimes I have them eliminate those. And we have lifestyle stuff. If you're not sleeping through the night, that's going to change your threshold for pain the next day. If you're not moving and moving your body and moving your joints, you're going to also change the way your joints behave. So eating, sleeping, moving are all critical to regeneration. So what we like to do is incorporate treatments that are going to be safe for you. For example, NSAIDs like Motrin and Aleve can maybe decrease inflammation, but they're also not great for your blood pressure, your kidneys, your lining of your stomach, so they can cause ulcers. So these are some side effects, but the treatments that we're looking at are things that are safe and can benefit you and give you long-lasting results. Next slide, please.
Neural therapy and acupuncture. In general, lifestyle really matters a ton, and movement is extremely important to maintain that joint, to maintain the function of the joint itself, maintain the muscles above and below the joint, and allowing the bones to heal when they get damaged. Many people are not able to do simple movements, which is probably the biggest issue that we deal with. I think a lot of interventions can make a huge difference in allowing that joint to function better.
Yeah, so the pain can affect our stress and our sleep patterns, which are critical for aging well and for reducing inflammation. And when conservative treatments don't work, we lean on some of these less invasive tools.
We've been using neural therapy, which is a type of treatment that's been around for quite some time, but I think it's getting more traction in the United States now. Neural therapy is based on the concept that the fascia itself is a real organ system that allows for different neurotransmitters and biochemicals to communicate. So when there's some type of trauma, injury, or even surgical scar, that system gets messed up. That highway system is no longer working. So by using Procaine, which is an anesthetic, we are able to inject just subcutaneously and allow for the fascia to become active again. And this allows for the ability to reset autonomic nervous system. And it reduces your inflammation at the nerve level. It improves local circulation. And we've got, like I said, this is relatively new to us in the States, but there's been a ton of evidence, high quality evidence in Europe that's been around for a while. And we're excited to be able to offer these types of treatments through Shakthi. The three main mechanisms of how this works is going to be increasing endorphin, decreasing your cortisol, and modulating your neuroimmune response. We have this leads to improved pain and function in knee osteoarthritis. There's been meta-analysis studies that have shown enhanced outcomes when combined with different types of injections. So by using neural therapy to almost prep the body or the joint to be able to respond to other therapies, we're getting better outcomes.
Right. And one mention on acupuncture. I'm the acupuncturist at Shakthi, and I've been using acupuncture for 25 years in my practice for almost anything that's internal medicine based. But we have this concept of meridians that go from in our bodies. It was developed 5,000 years ago. And these meridians go from our toes up our front of our body, down our back of our bodies. And when there's blockage of these meridians, it's thought to have some symptoms. So acupuncture can use these stainless steel needles with no injection to try to open up these meridians and increase flow, probably affecting the fascia, probably reminding the body that there's a problem. So if you think about like when you have chronic knee pain, it's too much for your body to carry it, your brain to think about it all the time, so it kind of shuts it off, as opposed to you waking up in the morning and hitting your foot on the door, your toe on the door of the bathroom. You have intense pain, but then it goes away really quickly because the body says there's a problem and sends anti-inflammatory cytokines to the area. But what acupuncture can do is remind the body that there's a problem here. So it recruits local blood flow, but also to increase anti-inflammatory cytokines and endorphins to come to the area almost as if it's a new injury. So that's in our practice, we combine sometimes the acupuncture and the neural therapy together to give a better benefit. Next slide.
Platelet-rich plasma, PRP. This is a way to use your own body's blood and plasma full of regenerative growth factors to help reduce inflammation, enhance tissue repair, and modulate your immune system, especially those macrophages. There is good evidence that shows PRP improves function versus when you compare it to placebo or hyaluronic acid. There are it's superior outcomes in some trials versus HA or hyaluronic acid itself. We feel that, or it's been shown that PRP regulates macrophage polarization by decreasing inflammation. So in essence, we use our own blood. We spin it down, and the plasma part has a ton of growth factors that can help reduce inflammation, improve tissue repair, and allow your immune system to work better, and allows for the decrease of overall inflammation.
So there, how long does it take in the practice to get this done?
The
I
procedure
mean, in the
itself,
sense of time for the drawing, concentrating, and injecting. How much time
oh,
is taken?
I'd say you give it about a half an hour of time to be here for the procedure. We draw anywhere from 18 to 60, or even sometimes 120 mLs of blood, depending on what we're trying to accomplish. And then we spin it down in a centrifuge, which takes about 5 minutes. And then we inject it under some type of image guidance. So that whole process probably takes about 30 minutes.
Yeah, and it's done at the office, right? It's done at the bedside. You don't have to go to a surgical center or anything like that.
Yep, you're right. We can do it in the office. In our practice locations, we sometimes do it in the surgery center just because that's where some of the imaging equipment is, but it's not a real surgery, and it's not treated like one.
Yeah. Next slide, please.
Exosomes, the next frontier in cellular repair. So exosomes have been around for quite some time and are extremely exciting. They're basically nano-sized vesicles, which are really particles that are secreted by stem cells. They carry proteins, lipids, and RNA, and they act as biological messengers sending signals between cells. They do not have any DNA, which means that the body doesn't attack it as a foreign substance. Exosomes instruct damaged cells to activate regenerative pathways, modulate immune responses, and reduce chronic inflammatory signaling in the knee. I like to tell people that PRP is great for mild to moderate pathology or problems, and exosomes are good for moderate to severe. I find that they're more potent than in PRP alone, but they can be used in conjunction with PRP. Exosomes offer a cell-free regenerative option with significant potential for cartilage and soft tissue restoration.
Yeah, so they contain, again, they're not cells, so they're just the growth factors and anti-inflammatory signals They really help the cells talk to each other. They really help. When we say immune modulation, we mean that they're able to tell certain tissues to repair and other tissues to, basically get out of the way. Autophagy and trying to get things cleaner in the space that you have. They're helpful for tissue repair signaling. So the evidence that's there is emerging. There's not as much evidence that shows this particular exosomes and the outcomes, but they're coming. And it does show, some of them do show that there's reduced inflammation and improved cartilage environment, because it kind of, the whole place where the knee sits, a lot of the inflammatory cells and the debris is kind of cleared out. So we're still limited in high quality human RCTs, but I think it's an exciting area where the data, I believe, will come. Next slide.
What got me
Oh, sorry, go
really
ahead.
interested in exosomes was right when the pandemic happened, when patients were prone on the ventilators and really nobody knew what to do. They started using these exosomes for those specific patients, and they started seeing significant outcomes improvement right in the times where we were all worried about what else we could do. That showed me that exosomes have a tremendous anti-inflammatory effect. So they were causing for decreased inflammation in the lungs in a way that we hadn't seen before. And I have also seen that similar type of decreased inflammation when we inject it intravenously, and it can go systemically, or when we use it into a specific joint. It usually takes about 4 weeks or so to kick in, but we've seen some pretty significant changes.
Yeah. And it's worth mentioning that both PRP and exosomes is a 4 to 6 week kind of a change that happens. It's not an immediate, like a cortisone shot, but its mechanism is to help you repair from within. So it will take a little bit longer. Next slide. So
So
this
this
is a
is
summary slide. So there, if you want to go through it.
so we've got PRP, which works on growth factors and overall repair. We've got exosomes, which really work on cellular signaling, neural therapy, which really leads to an autonomic reset, and acupuncture that can work by modulating the neuroimmune system itself. Now, used together, these work very well. Used individually, they also have their own benefits. I think what we're trying to explain is that there's a lot of synergy between these different types of regenerative therapies, and considering how to use them and when to use them is really the key to get the best outcomes.
Next slide.
So who can benefit really comes down to what are we diagnosing? In general, we've got different types of concerns or issues that occur at the knee itself. There's osteoarthritis, different grades of OA or osteoarthritis. There's meniscal tears. There are tendinopathies or inflammation of the tendons themselves. And there's ligament strains or sprains. Depending on what we're trying to treat, usually depends or determines what the overall and treatment should be or outcome could be. I'd say lifestyle modification is probably the first thing to look at. When we are looking at different types of activity levels, that could be contributing to the underlying problem. Athletes have their own different types of injuries that we know can occur. In general, we want to avoid surgery if we can. Surgery can be disruptive and traumatic to the joint. If we have other alternative therapies that can help restore and repair, that's really what we want to be looking at. We also have some patients who have had surgery and just haven't responded, and that's another potential candidate for these types of treatments. Who probably won't benefit from this, or who's not a candidate for regenerative therapies? If you've got severe bone-on-bone osteoarthritis, then unfortunately nothing's really going to help fix that. That being said, there have been some studies that have shown PRP injected in the subchondral area have promoted some improvement with severe OA, but I think in general you're probably looking at a replacement for it in that scenario. If you have any type of active infection or blood disorders, you're not a candidate for any of these regenerative therapies. And if you have a history of cancer, you wouldn't be a candidate for exosomes or stem cells. What to expect? Initial functional medicine evaluation and a review of your imaging is going to be the first thing we want to do. We want to come up with a customized protocol combining 2 or 3 different modalities to try to optimize the recovery and repair. These treatments are all completed in the office, usually taking about 30 to 60 minutes. You may have some mild soreness for a day or two after an injection or treatment. We expect improvement to take some time. So I'd say 4 to 12 weeks to really optimize your overall improvement. Most of our patients also use neurotherapy and peptides before and after these injections. We have found that peptide therapy has also been helpful in improving overall outcomes, and we have more and more patients asking us about peptides these days.
The other thing that we have combined before and after is also lymph treatments. So the lymph system is the kind of garbage disposal system that kind of takes the debris and the tissues that are no longer effective outside of the location. And our lymph system becomes pretty stagnant. Like when you have a cold or you have a sore throat, you feel the lymph nodes in your neck. But those lymph nodes and our lymph system is all over our body. So one of the ways that we also try to clear up the areas, we do what's called lymph enhancement therapy, LET, sometimes before and after the procedure, so that we can get optimal flow of the systems to be taking the debris out, so that again, you're reducing the area of inflammation within that joint space. Next slide. So there, can you tell us about some of your outcomes you've seen already?
Yeah, we've got 3 different stories here that were very impressive. The first was a pediatric dentist who uses his shoulders all the time. Came to me asking for some help because he was having difficulty exercising and felt that he had a rotator cuff injury. He had done normal physical therapy for it as it was. We started him on some peptides and did an exosome injection. And about 4 to 6 weeks later, he felt no pain and had full range of motion back in his shoulder, to the point where he came back and asked for the other shoulder to be treated, which always tells me that stuff works when people come back for treatments in other places. And he was extremely happy. He was able to regain the ability to do push-ups and do his normal type of work exercises. I had another patient who had chronic cervical spine degeneration, severe stenosis around the foramen, nerves compressed with numbness and tingling in the arms into the fingers. She wanted to avoid surgery, and we were able to inject the facets and around the nerves themselves with exosomes to provide improvement in nerve function. She felt nerve repair within a couple of days, and which lasted about 3 to 6 months at a time. She kept coming back for these injections. We were able to save her from having neck surgery for about 5 years. So very successful story there. And the third story here is someone who had lower back pain from multiple different causes. There was spondylolisthesis, or slipping of the bones was causing some narrowing of the nerves themselves, or narrowing around where the nerves were exiting. There were disc herniations. There was arthritis in the facet joints and in the sacroiliac joints. We tried traditional therapy, which was epidural steroid injections, radiofrequency ablation, SI joint injections, and they all gave her temporary relief, but the pain would come back to the point where she was having difficulty standing and working. So we went to exosomes and PRP, and we injected the facet joints and the SI joints. And within probably 3 to 4 weeks, she had significant improvement in her pain. She was able to stand and walk. She was able to resume her normal activities, which she was very happy for. And on a repeat MRI, she still has the same underlying anatomical issues. So it doesn't change the anatomy, but it changes how the nerves are sending signaling, and it changes what's going on in the joint itself.
Yeah, those are pretty powerful. Next slide.
Okay, so considerations. How do we make a decision beyond surgery? I would say that if if your knee hurts, we want to try to grade it and see how bad is it. So there are grades 1 through 4, and 1 to 3 are going to be osteoarthritis with soft tissue damage. Grade 4 is going to be instability of the joint and your severe osteoarthritis, bone on bone, and you're going to need surgery at that point. But short of that, I think we have a lot of regenerative therapies that could help. So grades 1 to 3, you can respond to neural therapy, peptides, PRP, and exosomes. And kind of working through that order is what we'd recommend to get the best results.
Yeah, we like to personalize it for everyone. Not everyone has the same protocol. Not everyone has to do the same protocol. It does, we do like to align it with your anatomy, your goals, and what lifestyle you have. Next slide. So, in the end, it's about an integrative approach to knee arthritis. It's a failure of repair, not just the bone on bone. And our regenerative therapies target root cause in terms of the inflammation and the the discomfort or the disassociation of the autonomic nervous system and blood flow situations, fascia repair. So the best outcome do come from the combination of approaches. Mostly everyone can start with things that reduce inflammation. That also includes lifestyle, movement, trying to get good night's sleep, eating a proper diet, avoiding inflammatory foods. At Shakthi, we spend a lot of time doing more with the gut, but you can also use things like acupuncture, neural therapy, PRP exosomes, work with physical therapy, all the traditional things that you've done that's conservative to rebuild your strength and also for recovery. Okay, next slide.
So in conclusion here, as a chronic pain specialist, I spend most of my time treating patients with steroids or modulating nerves through stimulation or radiofrequency ablation. But a lot of people either don't want that or have tried that and it hasn't worked, but want to avoid surgery. And that's where regenerative therapies come into play. It allows us to provide an integrative approach to decrease inflammation and improve functionality without using steroids that may only give you temporary relief, without ablating nerves that may lead to some other issues downstream. So by utilizing neural therapy to reset pain signals, acupuncture to restore your natural balance and your autonomic nervous system, PRP to amplify your own healing, or exosomes to regenerate at a cellular level, we're able to provide repair and we're able to repair the underlying problem and allow you to reclaim your life. So if you're looking for options to get more functional, get back to being able to do the things that you were doing before you injured your knee, then you should really consider regenerative therapies.
Yeah, and that's the end of the slideshow. But if you guys have cute questions, we're available for questions and answers.
Yep. We have some questions that have come in so far, and everyone can keep asking questions as we get started with the Q&A. And I see we have one attendee with their hand raised. I'll get to you in just a second. We're going to start with our first question and just go in order. All right, so the first question is, what are the approximate costs, assuming it is out of network?
So there.
So cost depends on what we're actually trying to accomplish. Unfortunately, these are not covered through insurance, but we create different programs that are personalized to each person. The cost could be anywhere from $500 to $8,000, depending on what we're trying to do. So I would highly encourage you to come in, get evaluated, and we can come up with a program for you.
All right. And I'll go to the next question. We actually got two questions from this individual, so we'll cover both here. Where and when can I come to see you and show you my knee? That's the first question. And then if I'm a candidate, will I be cured?
Well, you can see us in our offices in Elkridge and Mount Airy. We also have other offices throughout the state. Shakthi offices are Mount Airy and Elkridge. As far as curing your knee, well, I'd love to be able to say we could do that, but as you know, with medicine, um, nothing nothing's guaranteed. Our goal would be to try to improve your functionality, make that knee function better, so you can reclaim the types of activities that you were doing before. And we would be happy to review what the chances are of that actually happening. And we want to make sure that we are able to provide a solution for you that that you're happy with and that can hopefully get you the type of repair that you're looking for.
So also remember that with some of our examples that was used, the MRI didn't change. If you MRI 100 people, 50% of them have abnormal changes, not everyone's going to have pain. So there's a component that goes beyond anatomy. Sometimes the anatomy doesn't change, but what you are doing is changing the cellular communication within the tissue. You're changing the blood supply to the tissue. You're changing the fascia around the tissue. Those things can't be visualized on an X-ray or on a MRI, but what you do sometimes feel is you feel more range of motion, you feel like you can bear weight on it, you have more mobility. So the functionality of that joint improves significantly, even though you can't say that the anatomy is cured. So it's it's hard to say cure in this situation.
All right, we have a participant with their hand raised, so I'm going to turn on their microphone.
All right, can you hear me?
Yes.
Yes.
All right, great. Hi, I'm Kathleen Jefferson. And first of all, thank you so much for this. This was great. Dr. Rao, Dr. Sudhir Rao did not know I was going to be on the call, but I just wanted to let you guys know I have been a patient who has used exosomes. I had, I think, 3 injections over a period of time. I was in a near fatal accident, and Dr. Rao has absolutely gotten me back to an incredible place. It's taken me 11 years, but I've been working with him and it's been remarkable. The RFA ablations, how they've helped, and the exosomes in regenerating. Not only it reduced inflammation and being regenerative in terms of cellular production, but it really helped with stamina. So that's number one. And I wanted to mention in a different practice, I did have fascia. There's a doctor, I'm trying to think of what his name is, but anyway, I did have body work with really working on the fascia earlier in my recovery, and that was very helpful. It's delightful to know you guys offer that. The second thing I raised my hand about is I have had 1 knee replacement, and it was done by a very, very reputable guy, and he did a great job. The unfortunate thing for me is that the knee that was replaced, the knee that was put in, is bigger than the knee that I had. So I still have inflammation. So I really am thrilled. This is why I wanted to listen to this, because Dr. Rao, I'd love to come in and talk with you about what makes sense to try to, do that. I went through all the physical therapy, and the range of motion was where they expected it to be, but I'm 3.5, I think I'm 3 years out. From the knee surgery, and I still have some trouble with it. The other knee has a little bit bone on bone, but I would like to also discuss some PRP or something like that with you.
Well, absolutely. First of all, thank you so much for joining and saying such kind words. But I'm glad that you're able to share your story. Fortunately, your story is not unique. Many people have similar types of trials and tribulations post-operatively. But I'm glad to hear that the therapy that we provided has been helpful. I think 30% of patients after total knee replacement continue to have pain despite having the hardware in the right spot and the orthopedic surgeon saying we would not go back in and operate again. Everything is where it's supposed to be. In those scenarios, PRP or exosomes can help intravenously or injected above and below the joint. Acupuncture can be helpful. Neurotherapy with the fascia work can definitely help reset and make the joint more amenable to treatment. One thing we did not discuss on this presentation is genicular artery embolization. And this is a concept where a interventional radiologist accesses the blood vessels below the knee through a catheter that goes through the foot and embolizes, or really literally turns off these little arterioles that have formed around the knee. And these arterioles are causing for inflammation to be spread and causing knee pain. So that has been another option that is covered through insurance most of the time that can be something to look into.
All right. Thea, I see you have your hand raised. We have just 2 questions ahead of you, but I will get to you in just a second. All right. So next question here is, how will the peptides that will be legalized soon be used, like 157?
I can answer that. So we've used oral. There's the thing about peptides, especially BPC 157, is actually it's a peptide taken from the stomach acid. Some healthy stomach acid kind of acts like regenerative. You use your body's regenerative tools to heal yourself, type of thing. So it's great orally for lots of GI issues, for gastrointestinal issues, and it's wonderful for joint healing as well, and tendon healing. It does change the immune system to recruit cytokines that are anti-inflammatory and shuts down inflammatory ones, helps with blood flow, helps with angiogenesis. So it does increase your oxygenation. So one of the biggest things that happens in chronic pain is like there's not that much blood flow that gets to areas that are impaired. So if you imagine your body having chronic pain, the brain wants to save resources. So basically things that are chronic are kind of forgotten, and the blood supply to that area is shunted away. I mean, you're not going to turn blue and your limbs aren't going to fall off, but when we do the neural therapies and we doing acupuncture, we see the changes in the texture of the skin and the fascia because the blood flow starts to increase to that area, which means you're getting more oxygen, more nutrients to heal. And so that is one of the major benefits of BPC 157 is increasing blood flow. In the gut, it also increases your level of input for extracting nutrients. A lot of us are not absorbing what we're eating. And so nutrient deficiency is probably one of the biggest reasons we have chronic illness in this country. And so it's not just about what we eat, but it's also about how we extract those foods and nourish our tissues. And so I think BPC plays a very large role in delivering oxygen and blood flow, along with what it does for inflammation.
Okay. Before we get to the next question, we have some questions that have been flowing in about more resources, videos, and just information about our phone numbers and addresses. I'm going to be sending a copy of this presentation to everyone's email afterwards. I'm also going to include more resources like videos, digital guides, and then you'll be able to see our phone numbers and addresses there. So you'll have all that information and other video resources. So we did get a question about if we offer trainings online. Many of our videos cover all the topics that we discussed here. But if you have any other questions, there's going to be a place in that email to submit additional questions to us. All right, we'll move to a question from Thea, and I see you also have your hand raised, so I'll unmute you as well, but I'll read your questions first. If you have a knee replacement, will exosomes work still? And then how is the exosome applied? Is it an injection?
So if you've had a knee replacement, then the exosome can be injected above and below the knee, depending on what we think is causing the problem. You could also consider an intravenous infusion of the exosome, which will go systemically. It'll get to the knee, it'll decrease inflammation around the knee itself, but in coupling the IV and the local infiltration around the knee may be the best option in this scenario. Again, considering the genicular artery embolization may be something else that you want to look at as well.
And Thea, I've given you the option if you wanted to add anything when you had your hand raised. So I just wanted to give you the option to use voice if you had any other follow-up questions. All right. That is all the questions that we have for now. We'll wait. We'll wait another minute or so just to see if anything else comes in.
Just wanted to say thank you to everyone who showed up today. I really appreciate the comments that were made as well. We always love patient feedback and testimonials because it really helps when things are, especially in areas like this where some of the physicians you might see may not be on board with what you're, because they don't know enough about neural therapy or acupuncture or PRP or exosomes. But it's been pretty remarkable in our practice to see how our patients have been benefiting from these therapies. So I encourage you to ask more questions and, you know, talk to, if you're not local, you can't see us, talk to your providers about it. It's just such an amazing new bunch of tools that we have now that need to be discussed and at least give you options in terms of not just going to, you know, NSAIDs or pain medicines and surgery as your only two options and maybe physical therapy. So I really am so excited that you guys are all here learning about this. I'm very passionate about integrative medicine. We do these webinars every month, and if there's a topic that you'd like to listen to or you have a question about that's maybe pain related, maybe not pain related, check out our library and our Shakthi YouTube channel. We have a lot of topics that are related to lifestyle that help age us better. So again, appreciate you guys all being here.